you. Hi, Dr. Madassery. Hey, is there anything that we can do ourselves to try to slow the progression of the PAD?
Yes. Take all the risk factor medications, which is your statins, your Lipitors, keep your cholesterol well, get your glucose under control, stop smoking, walk as much as you can. If your kidneys are having issues, try to find out what can improve that. Keep your blood pressure in control. These are the risks. If you can adjust and optimize the risk factors of PAD, then you're going to slow the progression of it. So the biggest things usually for most of our patients in the population are diabetes and smoking. So if you're a smoker, it's very tough. Trust me, my dad smoked 50 years. I get it. But when you're facing losing limbs and fingers, that's sometimes the wake up call, or you need to keep working with it. There's programs, there's medications. My dad tried hypnosis, water therapy. I mean, God knows what all. But smoking and diabetes are the two biggest ones. Next to that, it's going to be your cholesterol medications, your blood pressure, which again, all these things also cause strokes and heart attacks. So it's not just for your legs; it's for your heart, and your brain.
Great.
I
Thank
think,
you.
wouldn't you love a patient to come in and ask you that question? What can I do? How can I help, doc?
I know.
How can I make a difference?
It's usually what can you do for me without changing anything I'm doing?
Exactly.